Like my brother, there's going to be a lot
Recording in progress.
It's okay. Start. Good afternoon, everyone, and thank you very much for joining us. My name is Cheryl Davies, and I'm the Chief Operating Officer at BC Women's Hospital and Health Centre. Before we begin, I would just like to acknowledge that we are gathered today here on the ancestral traditional land of the Coast Salish people, the Musqueam, Squamish, and Tsleil-Waututh nations. And it's an honor and privilege to be here on this land for this announcement today and to work for myself and my team on these lands every day. I'm joined today by Minister Mark Holland, our Federal Minister of Health, Minister Adrian Dix, our British Columbia Minister of Health, and Dr. Stephanie Roan, who is our Senior Medical Director here at BC Women's Hospital and Health Centre. Without further ado, I would like to invite Minister Mark Holland to share why we are here today.
Merci, Cheryl. C'est un grand plaisir d'être ici aujourd'hui avec vous pour un jour vraiment important et historique pour le Colombie-Britannique, mais aussi pour le Canada. Folks, I want to start by just acknowledging how important the partnership is between British Columbia and the Government of Canada in health. And I specifically want to take an opportunity to thank Minister Dix. You know, when we were dealing with working together and trying to find solutions around doctors and primary care and nurses, it was BC that was first in signing agreement on working together. When we're talking about aging at home and aging with dignity and making sure that we improve the conditions for those in long-term care facilities, BC was first in signing the Aging with Dignity Agreement. When we talk about making sure that healthcare assistants get a fair wage and are treated fairly, it was British Columbia that signed an agreement first and set the tone for the rest of the country. On drugs for rare diseases, it was British Columbia that signed an agreement first. And today, in a moment, we're talking about another first. And it shows what's possible with collaboration. You know, when we work together, and I'll just take bulk purchasing as an example. When federal and provincial governments work together through purchasing together, we're able to reduce drug costs in this country by about $3.4 billion every single year. And so there's two paths forward. There's one that's rooted in collaboration, in finding common ground, in finding solutions. And Adrian Dix is an incredible model of that and his leadership. Or there's division, tearing down, pointing fingers, finding blame. And that's an alternative that's at stake over the next year as we have debates about the future of this country. But I am so proud and happy to be here today to make an incredibly important announcement. Aujourd'hui, l'honorable Adrian Dix et moi-même confirmons notre intention de travailler ensemble pour rendre les médicaments d'ordonnance plus accessibles et plus abordables. Lorsque le projet de loi C-64 aura reçu la sanction royale, le gouvernement du Canada entamera les négociations officielles avec le gouvernement de Colombie-Britannique afin de mettre en place une couverture universelle au premier dollar et au premier unique pour une gamme de contraceptifs et les médicaments contre le diabète. And there's a couple of things exceptionally important here. I see my colleague Randeep Sarai. Randeep, who's been so passionate about pharmacare. And actually, you know, and I want to take a moment as well to thank Don Davies. You know, Cheryl, who's such a leader, and I want to thank the BC Women's Hospital, knows a little bit about Don Davies, I would say. But this wouldn't be possible without his partnership, and I want to thank him. But this, what we're talking about today, this memorandum of understanding that we are signing, talking about what our two governments are going to do together, is essentially about freedom. And I want to talk about that in three different dimensions that are important for us here today. First, with respect to diabetes. If you're a diabetes patient, how many doctors do I talk to who have a patient in front of them who is diabetic, and they're telling them what medication they need to take, what food they need to eat, And they're saying, why am I even bothering meeting with this patient? They don't have the money for the medication. They don't have the money for the food. And it means that they can't follow that regime. For that person, where is the freedom for their life if they don't have access to the medication that they need to be able to live that life? Making sure that every person is a diabetic has access to the medication they need means that they can live a life free from the ravages of that and free from the costs of it. You know, as a society in Canada, we spend about $30 billion a year on managing diabetes. We wait for it to get into a crisis. We have people who don't have access to medication who wind up losing limbs or getting much more serious chronic disease and illness. That's not a way to manage a health system. The way to manage a health system is to make sure that people have the medication they need so they don't get sicker, so they can manage that condition, and we could do the work, hopefully, that they get off diabetes. On contraception, what is more fundamental when we talk about freedom than a woman's ability to have control over her own body, to make the decision if or if not she wants to start a family, to make sure she has access to the contraception that she needs to make that choice? It is fundamentally unfair, unjust, and inequitable that we live in a society today where women don't have access to the contraception that they need, and it means that they're forced into a situation to have a circumstance they did not choose. It is fundamentally freedom that they have that option. And I think we want to live in a country where every woman, everywhere, in every inch of this country has access to that choice, has control over their own body. And I would say to those who play in the margins, they're against abortion, they're against access to contraception, they're against sex education, then you're against the freedom of women, full stop. You can't be against all three of those things. And so I'm very hopeful in the House of Commons that we'll have consensus at least around the idea that women should have access to the contraceptive medication that they need. I want to say by signing this memorandum of understanding first here with Minister Dix today, that we're doing something fundamentally important for women's health as well. And that's on menopause hormone therapy. To make sure that as in that aging journey, and for women, about 1/3 of their life is going to be spent in a post-menopause state. Helping make that adjustment, that's not a conversation we have nearly enough. And the fact that so many women can't afford that treatment means fundamentally devastating things for their health. It's not just about discomfort. It's not just about not being able to sleep. You know, we make jokes about hot flashes and how discomfort it is. Like, we rely on these women for our economy, for our caregiving. And then they're forced to endure that experience and have us make jokes about it. But it also affects things like bone density. It affects the future of their health. It fundamentally is prevention. And the fact that we have solutions and that there are women who don't have access to that solutions is fundamentally about freedom. Is about saying to women everywhere in the country that as you age, we're there with you to make sure you have what you need so you can support your family, so that you can go to work, so that you can be productive. And I think this is emblematic. It's so important. Again, here we are in BC, where BC is leading. It sets the tone. We said when Randeep and I were working to try to get this through the House of Commons that this was a minimum, right? Making sure that contraceptives and making sure that diabetes medication was a minimum. We wanted to work with provinces and territories together to see if we could go further. And today is an example of exactly that. With that, it's my great privilege to invite to the microphone Minister Dix.
Thank you very much, Minister Holland, Mark. This is a profound and historic day, I think, for people in BC. And sometimes I think in Canada, we understate the significance of the things we do. It's sometimes one of the best parts of being Canadians, I suppose. But also, we need to recognize the significance of what today represents and what the actions that federal and provincial governments are taking together on pharmacare mean for people. As Mark has mentioned, Bill C-64 or the National Pharmacare Plan that the federal government has put forward starts with critically important medications for people. I have type 1 diabetes. I know a little bit about insulin. Took it this morning, took it all the other mornings too, for 30 odd years. And what I can say is about insulin, and I can say about metformin for people with type 2 diabetes, that about, on our pharmacare program, about 121,000 beneficiaries. 150,000 people get diabetes drugs and medications in British Columbia, which means in the millions in Canada. That insulin in particular is Canada's drug. It was, in some ways, discovered isn't the right word, but it was Banting and Best. It's something we all learned in school. And Banting and Best gave this drug to the world without the same patents that are so much part of healthcare today. It was very Canadian. I can tell you, millions of people are alive, including me, because we had brilliant scientists in Canada, and because we gave people access to this drug, and because it's so important fundamentally to their health. In this country, there are 300,000 people with type 1 diabetes, and there are about, depending on how you count, 4 million people with type 2 diabetes today. And so I heard recently that the action the federal government had taken as part of its pharmacare plan was only insulin, and it was only contraception, only insulin. You hear Vice President Kamala Harris in the debate just a couple of nights ago. I think a few people watched that debate, and she talked about capping the cost of insulin at $36 a month or $420 a year. She found it so important that she centered that in her debate. She said it in her convention speech. About 7 other people did as well. It's a significant achievement of American healthcare. Cost of insulin in Canada, because of the action that's being taken here, 0. And while they recognize that in the United States, we should recognize what this means for people with diabetes in Canada, both type 1 and type 2. It is an enormous achievement. And I agree, and we have a letter of intent saying we are proceeding in British Columbia on diabetes medications. It makes a huge difference to people. Contraception. It is, I think, a fundamental principle of equality. It's also about, as it is for people with diabetes, about costs. Let's give you an example on diabetes. As you know, I've had it for a long time, and I can afford to deal with it. Probably after taxes, $120,000 is what it's cost me. On contraception, we last year put in place free contraception in British Columbia for over 60 contraceptive products. What an extraordinary thing. Most women, especially young women, but most women who take contraception tend not to get any benefit out of pharmacare because they are typically otherwise healthy and typically don't meet their deductible limits. It makes a huge difference because it is women who have the primary responsibility here. They have the responsibility for everything, including the cost. And so in British Columbia, we changed that, and we asked other jurisdictions and advocated for other jurisdictions to do it. And Minister Holland, who I've really had the honor to work with, took that up, and he is bringing that across the country. 264,000 women in British Columbia have been able to access free contraception. 264,000. You take that by the country, and that's probably in the neighborhood of 2 million Canadian women who will benefit from these actions today, of extending what we did in BC, of the federal government seeing it and saying this has to happen, and extending it across the country. Now in BC, the federal approach on diabetes and on contraception meant that we were already doing contraception. So there's a number of approaches you could take. You could say, well, we'll take the money and apply that. But we wanted to do more together, Minister Holland and I. And that is why today we are taking that money the between 30 and 40 million dollars in BC that will come from the federal government for contraception, and applying it to something else, to make something else free at point of purchase, free for British Columbia women. And that is the step that he mentioned today, menopausal hormone therapy, or hormone, sometimes called hormone replacement therapy, HRT, which is today, by making it free, by giving access, and by extending access to that therapy here in British Columbia, will benefit in the course of an average year at least 40,000 women, saving them $400 or more a year on average. That is a significant improvement in lives. So we have diabetes, a drug, and insulin, and other type 2 diabetes drugs like metformin, which people need to stay alive. We have contraception, which is a fundamental act of reducing costs for younger women, as well as, I would argue, making a massive change in the way that we view healthcare in our country. And now, in British Columbia, a further change for another group of women who require care and support, require support implied by such therapies, and will now get it free at point of access, saving hundreds of dollars a year, and also taking away the burden of that for them. And so I am very proud of the direction we've taken, of the agreement that we've signed on to today, Minister Holland and I, and his government and our government, to make life better for people in British Columbia, to make life more affordable for people in British Columbia and across the country, but also, I think, to improve access to basic health care, something that's fundamental for everybody. It's a real, true honor for me to be involved in such a process, involved with people who are committed to making lives better for people. That's what this agreement does. I'm very proud to support it. And thank you very much. I'll hand it back to you, Cheryl, to make the next introduction.
Oh, thank you. I'd like to now invite Dr. Stephanie Roan to the podium to share with us what this means for women and people that we serve.
Good afternoon, everyone. I am so delighted to be here and to share in these announcements, which really are fundamental in improving healthcare for women in BC and across Canada. I am the Senior Medical Director here at Women's Hospital, and I am also a practicing OBGYN. So I see patients benefiting from these policies on a weekly basis, and I have already seen the impact that free contraception has had on access and care for women across the lifespan. So women in their early reproductive years who are seeking contraceptive options, right up through perimenopause, where women still require contraception. This policy has been a game changer. It has allowed women to have the breadth of choice that they did not have previously. And having been in pre and post this policy, I can tell you as a physician, it relieves the burden and improves care both for patients and physicians to be able to provide patients with the health care that they need. And I am so proud to be part of this announcement today. At BC Women's Hospital, we're the leading hospital for women's health, and we are fortunate to provide treatment, care, and support for a wide range of patients across the lifespan, each with varying and unique needs. We also engage in significant research and advocacy for women's and newborn health, paving the way for policy decisions to improve healthcare at both provincial and national levels. Our own Wendy Norman, who is with us today, did the research study on contraceptive cost effectiveness, which directly contributed to the implementation of the BC Universal Contraceptive Policy in 2023, and similar federal announcement earlier this year, which has benefited millions of people across BC and Canada. I'm so delighted that this vital research and advocacy has led to health system savings that can be invested to support other areas of women's healthcare, and in particular, menopausal hormone therapy. This improves care and overall quality of life. As a clinician who cares for people with debilitating menopausal symptoms, I am thrilled to be part of today's announcement. Menopausal hormone therapy is an essential treatment that can provide much needed relief to people experiencing symptoms of menopause. We know that untreated menopausal symptoms have very significant impact on people's health, quality of life, and on the ability to work. Equitable access to menopausal hormone therapy will ensure that people receive the care they need for healthy aging. We also know that as we improve the health and quality of life for women, this has a ripple effect for their families, for their relationships in the workplace, and for their productivity. I am very grateful to be part of today's announcement and for the ongoing collaboration between government and healthcare partners as we continue to work to improve health and health equity for women and people, not only in BC and across Canada. This step forward in terms of funding for menopausal hormone therapy will support patients I see every week, and I am very grateful for that. Thank you to Minister Holland, to Minister Dix, the Government of Canada, and the Province of BC for supporting access to this life-changing treatment for so many.
Thank you, Dr. Ronan, for everything you do here at BC Women's Hospital. I would like to take this opportunity to thank Minister Dix, Minister Holland, and Dr. Roan for coming here today. I think what we're seeing is what can really be achieved across in our healthcare system when we have collaboration from clinicians and researchers to policymakers and government leaders, both at provincial and federal levels. I want to thank Minister Dix for his leadership in making this historic advancement in providing contraception free in British Columbia last year, for working federally, and for your leadership, Minister Holland, in implementing a federal pharmacare program, which is a historic milestone in our Canadian history in advancing healthcare for Canadians. And with that, taking the step to advance health for women and trans and non-binary people in the area of ensuring right to bodily autonomy and therefore choices that they can make in their lives for themselves and their families and communities. And now today, for advancing once again access to another important medication, which will be life-changing, life-altering, not only for the people who can access them, but for their families and communities around them who live with them. So I want to thank you all for joining us today. And now Minister Holland and Minister Dix will take some questions.
Bienvenue à toutes et à tous. I'm Minister Holland's press secretary. Je suis l'attaché de presse du ministre Holland. We will begin with questions in the room before taking questions from Zoom. Please state your name, media outlet, and to whom your question is directed. You will have the opportunity to ask one question and one follow-up. Minister Holland will have to be heading out shortly, so if you could start with questions directed to him, that would be appreciated. Nous commencerons par les questions dans la salle avant de prendre les questions de Zoom. Veuillez indiquer votre nom, votre média et à qui vous posez votre question. Vous aurez la possibilité de poser une question avec un suivi. Si vous pouviez commencer par poser des questions au ministre Holland, ce serait apprécié. Let's proceed to the first question. Nous allons passer à la première question.
Good afternoon. I'm Joe Sadowski from City News. When will this new policy be implemented, and when can Canadians, see this come into effect?
So I'll leave it to Minister Dix to talk about British Columbia, but we're signing a memorandum of agreement here today, a memorandum of understanding. So that lays out the framework. We have to get through the Senate. So the Senate is finishing its process. Obviously, we're very respectful of that. But I had said in June that we weren't going to wait for the Senate to finish. We were going to make sure that we talked with provinces and territories so that we could do exactly this, show what it would mean and be ready when the Senate passed so we could get these life-saving medications to people as quickly as possible. My objective remains, and I am confident that we can achieve it, to sign an agreement with every jurisdiction in the country, every province, every territory prior to April 1st of next year, and to get drugs flowing in every jurisdiction in that timeline, and that remains. I don't know if you want to. That's good.
Hi, Travis Prasad, Global News. Question for Minister Dix. Hi, I wanted to ask you about the harm reduction vending machines on the island. They've been removed pending the review by the ministry. Just wondering what informed the decision to remove the vending machines pending the review? Why aren't they staying in place at the moment?
We're we're looking at that issue and what the appropriate items would be in such vending machines should they continue to be there. And so we're reviewing it, and while we're reviewing it, we've taken away the vending machines.
These machines came in to place, I believe, last October. Without issue, really didn't hear much about that until a video went viral by one of the Conservative candidates in Nanaimo in August. Why give in to that pressure from the Conservatives to change anything about your policy when it comes to these kiosks?
Our issue is to get it right. We're looking and reviewing it, the items that are in that vending machine. We want to ensure that people have access to healthcare and public health. That's what today's announcement's all about. So our view is always to get these issues right and to work hard to do that in every single case. And that's what we've demonstrated over years, for example, in dealing with the COVID-19 pandemic, where we adjusted and adapted all the time to ensure we had the best possible care in BC. That's why we led North America in that care, and it's the approach we're going to continue to take.
Thanks.
Bonjour, Wills Paul avec Radio-Canada. Pour vous, encore une fois, ministre Dix. Alors, John Rosted qui a annoncé son soutien au traitement involontaire pour les personnes souffrant de graves dépendances. J'aimerais avoir d'abord votre réaction et quelle est la position du gouvernement par rapport à ces traitements involontaires?
Mais on ne peut pas, je pense, avoir une politique de la santé qui vise les pas jeunes, qui vise des headlines. Nous travaillons ensemble pour protéger les gens, pour combattre l'effet de la toxonomie et aussi d'avoir des meilleures politiques pour protéger la communauté aussi. Et c'est ce que nous avons l'intention de continuer. On fait un travail actuellement avec Dr. Daniel Vigo, qui fait un travail important avec nous, et je sais que le Premier ministre va avoir plus à dire bientôt.
Mais sur ce genre de traitement involontaire, est-ce quelque chose que vous appuyez en ce moment?
Mais de donner, ce qu'il faut, c'est du traitement, n'est-ce pas? Et malheureusement, M. Rostad, qui est contre la santé publique, qui est contre le traitement quand il était au bureau, au gouvernement, n'est-ce pas? Qui n'a pas mis en place un système de traitement du tout avant 2017. De dire cela maintenant, c'est quand même difficile d'en croire. Il soutient une coupure de 4,2 milliards de dollars du système de santé. Il parle d'augmentation. C'est absolument le bon chemin. Ce que nous avons nous allons mettre l'accent sur ce qui est essentiel, c'est la protection de la communauté et le traitement des gens.
Merci.
We will now proceed to questions from journalists online with Zoom. Nous allons maintenant prendre des questions des journalistes sur le Zoom.
If you're a reporter and wish to ask a question, please use the raise hand function. We ask for a limit of one question and one follow-up. Unless I have stated it, please indicate your name and media outlet before asking your question. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et une suivie. Sauf si je l'ai dit, veuillez identifier votre nom et votre média avant de poser votre question. We have our first question from Ashley Joannou.
Hi, this is Ashley from the Canadian Press. I just have some basic question about how much money is BC's portion of this deal? I know I heard the minister mention 30 to 40 million for the contraception portion of it, but how much is BC's total share of this deal?
Well, remember, we have a pharmacare system in place now, and the purpose here is to continue to spend money on pharmacare and have the federal government move on diabetes medications, on contraception, and now on HRT to make that first dollar coverage, meaning that it's essentially free to British Columbians. And so the value of the deal is significant. I'll have Minister Holland talk about the national budget for the first year. It's significant. In the case of menopausal hormone therapy, we estimate that the value of this for women in our province is about between $32 and $34 million as we expand out that program. And that's a strong indication of the value of it. With respect to contraception, it's about the same, but we have a program. So that is a very similar amount of money that British Columbia pays already. So rather than use that money just for general revenue, you're using the money from the federal government to expand out those programs. But those two programs, they have that value. And we're going to continue, obviously, to provide contraception. There's 264,000 British Columbia women who've benefited from that. And the rough cost is about $35 million, which the federal plan would take up effectively. That creates an opportunity to provide first dollar or free coverage for menopausal hormone therapy, and that's what we're doing. And obviously, there's significant benefit on the diabetes side as well. So overall, this is very beneficial to British Columbians because it saves British Columbia patients and people in the community a lot of money. If you're someone who needs HRT or therapy, for example, that'll be about $400 a year. It's in the hundreds for people with contraceptions over a wide-ranging community, and that's the value of the deal. So the benefit isn't to government, the benefit is to people.
But how much money are we talking about? You keep saying significant, and you've said 35 for the contraception term hormone replacement. But what about the diabetes money? What's the total amount of money that is being given to BC?
Yeah, so it's important that the amount that I had stated, and I go back to the announcement that we made at the beginning, which is about $1.5 billion for the country if every province and every territory is participating. And so you can extrapolate BC is about 13% of the health system. So it's roughly around that dollar amount. But I would say that this is, we don't have the exact dollar amount because this is a memorandum of understanding. It gives us the contours of what we're going to do. And obviously, we have to wait for royal assent to sign the final agreement so we can give you a final number. But as a rough estimate, you can take that 1.5 billion, say BC is about 13% of that, and that's about the annual cost that we're looking at.
We will now proceed to a question from Bob McKinn.
Hello, good afternoon. This is for Minister Dix. I understand that the new Surrey Hospital construction site does not have a building permit, only an excavation permit. Why is there no building permit for the site at this time? Has an application been filed, or when will we know about that? And also, what's being done to address concerns about the groundwater? Is this causing a delay and an additional cost?
Well, no. In fact, this is how we build every hospital project in BC. If you look at Royal Inland Hospital, this was your question, I guess, is an issue raised by the Conservative leader who's simply misleading the people of Surrey. We do sequential permitting on big projects. You don't wait for all the permits to start with the process forward, whether it's, and so we've got all the appropriate permits and we're moving forward, and you get the final building permit on the edge of 4 sets of permits that you do. And this is sequential permitting. It's done on every project. It was done when Mr. Rustad was in government, and he either doesn't know that or he's deliberately misleading the people of Surrey. We've got one of the outstanding construction companies who builds hospitals in Canada and North America, Ellis Don, doing it. They're getting all the appropriate permits and we're going forward. And this is simply what Mr. Rustad says is simply false.
I've got a second question about the Information and Privacy Commissioner's audit of Vancouver Coastal Health. He found that Vancouver Coastal Health broke the FOI law on numerous occasions and even discriminated against media applicants. It failed to comply with time limits in 3/4 of files sampled and responded to less than a quarter of requests within the 30-day benchmark. Your government promised better, but hasn't delivered. Do you still have confidence in Penny Ballum to remain as chair?
Let me speak about Penny Ballum. Dr. Ballum has been a healthcare leader in this city and in this province and in this country all her life. She's an outstanding physician. She's led the province as Deputy Minister of Health, led the city as city manager. She's been chair of the Vancouver Coastal Health, and she led our country leading, our North America leading vaccine program. So do I have confidence in Dr. Penny Ballum? You bet I do. I think she's an outstanding physician and health leader. I'm very proud to work with her.
We have one final question from Kathy Brown, CBC.
Yes, good afternoon. This is a follow-up to the harm reduction vending machine question on behalf of a colleague of mine. Are you anticipating any fallout or additional strain on emergency rooms now that people don't have access to these supplies through the vending machines?
Well, people have access to supplies and that are needed to keep them safe. We're doing a review of the vending machine, and it makes sense that we do it. And once the review is completed, we'll have further action. But I'm not anticipating a significant impact from that at all. Hey, thank
And
you.
this concludes today's event. Thank you everyone for participating. Ceci conclut l'événement d'aujourd'hui. Merci à tous.